Good morning, everyone. So, you can see this is your previous year pharmacist examination question of 2020. So, this booklet contains 100 objective type questions with multiple choice answer. It has three parts where part 1 contains 10 questions of arithmetic and part 2 contains 5 questions of English and part 3 contains 85 questions on pharmacy paper, on pharmacy subject. Here total time is 2 hours and maximum mark is 100. And for correct answer there will be 1 mark, and for wrong answer 0.25 marks will be deducted. So this is a part 1, part 2 and this one is part 3. So part 3 contains pharmacy questions. So I will discuss some of the HAP related questions, anatomy and physiology related questions from it. So first come to question number 17. What is the chemical name of vitamin C? Options are ascorbic acid, benzoic acid, malic acid and none of the above. So the correct answer will be ascorbic acid, which is called vitamin C. Next, come to question number 22. Cod liver oil is nutritive due to presence of which of the following vitamins? We all know cod liver oil has some vital vitamins. So options are vitamin A and D, vitamin A and E and vitamin E. So the correct answer will be vitamin A and D, option B. It contains both the vitamin A and D. Next question number 23. Immunoglobulin found in allergic condition is which of the following? Immunoglobulin are the normal antibodies which are present in our body. So which of the following are immunoglobulin found in allergic condition? So options are IgM, IgE, IgD and IgA. So the correct answer will be IgE. IgM normally found in blood and lymph, and IgD found in B lymphocytes, and IgA, which is normally found in the mucous membrane like saliva, tears and breast milk of mothers. So here IgA are found. So correct answer will be IgE for allergic condition. Next, so question number 24 is posology related question. So it is also a very simple question. Posology deals with, it is a suited question. So posology is normally related with dose of drugs. We generally calculate the dosage form of drugs through posology. Okay. Next question is 25. What is the capacity of bladder? The capacity of bladder and options are 100 ml, 500 ml, 200 ml and 1 liter. So the correct answer will be option B, 500. Generally it comes between 300 to 500 ml. So 500 will be appropriate. So 400 to 500, or in cups it will be measured as 2 cups. 2 cups or 4 to 500 ml of capacity. So next is, water as vehicle can transmit all except which of the following disease? It means water can cause which of the following disease cannot transmit through water? Options are polio, diarrhea, tetanus and roundworm. So the correct answer will be tetanus. It has very less chances to be transmitted through the water. Polio, diarrhea and roundworm are generally transmitted through the water. Next is question number 28. So DNA is mainly present in which of the following? Options are ribosome, nucleus, plasma membrane and none of this. So correct answer will be nucleus. Next, question number 30. Caustic soda is the synonym of? Very easy question. It will be NaOH or sodium hydroxide. I am only discussing about the anatomy and physiology questions. So next is 36. Which of the following is synthetic sweetener? Answer will be aspartame. Synthetic means which you can't get from natural sources. Question number 37. In diabetes mellitus, the level of what increases in the blood? Options are sucrose level, calcium level, glucose level or none of the above. So it is also a very simple question or easy question. The answer will be glucose level increases in our blood. Next, question number 39. Enteric coated tablets are meant for disintegration in which of the following? So enteric coated tablets. Enteric coated means what? These are the tablets which are coated with some polymers, generally to prevent them from dissolving in stomach acid, so that they can work properly. So the options are stomach, mouth, intestine and none of these. So it's obvious stomach is not the answer. Remaining are mouth, intestine and none of these. So the correct answer will be intestine. So enteric coated tablets are generally meant for disintegration in intestine. So next, question number 40. The most important component of human gamma globulin is? The most important component of human gamma globulin is IgG. G for gamma. So this will be the answer. IgG. Option A. Next, coming towards the question number 44. Fluid part of the blood devoid of corpuscles is called. Options are serum, plasma, lymph, and tissue fluid. So, which of the following questions, which of the following answers is the fluid part of the blood devoid of corpuscle? So, the correct answer will be first coming towards serum. Serum is normally a liquid part of the blood without clotting factors. The liquid part of the blood which does not contain the clotting factors is known as serum. And coming towards lymph, lymph is the fluid which flows inside our lymphatic vessels. Lymphatic vessels, lymph nodes, etc. And these are the tissue fluid. Tissue fluids are the fluid which passes between the tissues or present inside the tissues. So remaining one is plasma. So plasma is the fluid part of blood devoid of blood corpuscles. So correct answer will be B, plasma. Multiple form of enzymes are called as isoenzymes. Next, coming towards question number 50. During starvation, the level of DAS increases in the level of DAS in the blood decreases. During starvation means during hungry period, what will be decrease? What will be decrease in our blood? Options are ammonia, chloride and glucose, creatine and uric acid. Here the correct answer will be chloride and glucose. So normally during starvation, the stored glucose are decreases. They started to utilize in our blood, in our body for energy sources. So during starvation or during hungry period, the glucose level in our blood and chloride levels are decreases. Next, coming towards question number 52. An isotonic solution has the same as option A, pH of blood, fluid pressure as blood, C, specific gravity as blood, or D, osmotic pressure as blood. What will be the isotonic solution? So isotonic solution means that fluid or solution has same osmotic pressure as blood. If osmotic pressure between two solution is same, it is known as isotonic solution. If some solution or one solution has higher solid concentration, it is known as hypertonic. And if some solution has less solid concentration, it is known as hypotonic solution. So in this case, isotonic means same solid concentration with compared to other solution. So option number D will be the correct answer. Next, coming towards 54. The normal human blood pH is. pH questions are generally coming in competitive examination. So these are very important questions. Normal blood pH each. Option A 5.5 to 6.5, option B 8.8 to 9.6, option C 7.35 to 7.45, and option D 2.35 to 3.78. The correct answer will be option C 7.35 to 7.45. Slightly alkaline. So this is very important question. Next, coming towards question number 58. The body fluids found within the cells is called as. Options are plasma, extracellular fluid, interstitial fluid, and intracellular fluid. So what will be the answer? Plasma, as we know, the fluid part of the blood devoid of corpuscle. So this is not the answer. And what is the extracellular fluid? These are the fluid present outside the cell. So this is not the answer. What is the interstitial fluid? Interstitial fluids are the fluids present in between the spaces found in cells or tissue. These are the fluid found in the empty spaces of or the gap between the cells or tissues. These are known as interstitial fluid. This is also not the answer. Then the remaining one, intracellular fluid. So body fluid which found inside the cell is known as intracellular, and which is outside the cell is called as extracellular fluid. Next, hepatitis, 62 question number. Hepatitis is characterized by inflammation of lungs, skin rashes, inflammation of liver, or edema. So the correct answer will be inflammation of liver. Hepatitis is a viral disorder or disease which affects the liver or which cause the inflammation of liver. Question number 67. Lactose is made up of option A, one glucose molecule and one galactose molecule, option 2, two glucose molecule, option C, one glucose and one fructose, and option D, two galactose molecule. So the correct answer will be one glucose molecule and one galactose molecule. The lactose is normally a disaccharide, also commonly known as milk sugar. This is also an important factor. Milk sugar is known as lactose. Next, question number 76. The commonest form of malaria in India is caused by. Which of the following is the commonest form of malaria? Options are Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, and Plasmodium malariae. So the commonest form, there are two forms are very common. Those are Plasmodium falciparum and Plasmodium vivax also. So most common will be Plasmodium falciparum. So if there is an option like both A and C, that will be also a correct answer. So in this case, Plasmodium falciparum will be the correct answer, as it is the most commonest form of malaria in India. So next question is 83. Spinal cord ends at the vertebral level of which of the following? Options are T11, T12, option B T12, L1, option C L1, L2, option D L3 and L4. The question means where the spinal cord ends, at which vertebral level the spinal cord ends. There are 7 cervical vertebra, 12 thoracic vertebra and 5 lumbar vertebra also. So spinal cord generally runs from the cervical to the lumbar, that to be to the up to L1 and L2. These are the lumbar vertebra. There are 5 lumbar vertebra. So spinal cord runs up to the vertebra, lumbar vertebra L1 and L2. So option C will be the correct answer. So next, coming towards question number 90. What is the only artery which contains deoxygenated blood? The only artery which contains deoxygenated blood. Options are pulmonary artery, B inferior vena cava, C coronary artery and D none of the above. So in here inferior vena cava is the vein. Option A and option C coronary artery and pulmonary artery. So option A here will be the correct answer because pulmonary artery is the only artery which contains or which carries the deoxygenated blood. Normally artery carries the oxygenated blood. So the pulmonary artery which is which runs from the heart to lungs. It carries the deoxygenated blood from heart to lungs for to convert them to the oxygenated blood. So the answer will be option A, pulmonary artery, which is present inside the heart and connected to the lungs. It is the only artery which contains deoxygenated or carries deoxygenated blood. This is also very important questions which comes generally in many competitive examinations, OJE, GPAT level also. So next, coming towards question number 93. What is the normal amount of platelets in a healthy human? So all of us know the normal count of platelets are 1,50,000 to 4,50,000 per microliter. So from 1,50,000 to 4,50,000, in between these options A will be the correct answer. 2,50,000 to 4 lakhs are present. So option A will be the correct answer. Next, coming towards question number 94. What is the average volume of blood in human body? Options are A 5.5 liters, B 4 liters, C 10 liters and D 6 liters. Here the option will be the answer will be option A 5.5 liters, or we can generally say 5 liters. Next, coming towards question number 100. What is the normal level of calcium in blood plasma? Options are A 9 to 11 mg per 100 ml, B 20 to 40 mg per 100 ml, C 30 to 40 mg per 100 ml, and D 100 mg per 100 ml. So what will be the normal level of calcium in blood plasma? Here option A will be the correct answer, 9 to 11 mg per 100 ml. If there will be mg per dl, that will also correct, 9 to 11 mg 9 to 11 mg per dl also correct answer, because 1 deciliter equal to 100 ml. So both of them will be correct answer. So if calcium level normally lies between 9 to 11 mg per dl, so if exceeds from it, it will cause hypercalcemia. If decreases from it, it will cause hypocalcemia. So these are the anatomy and physiology related regarding questions which came in the previous year pharmacist examination. So normally we can find many questions from the blood, tissue fluid, and heart, etc. So in the upcoming classes we will discuss chapter wise or the subject wise, like from the organ wise, like heart, kidney, urinary system. We can discuss those related multiple choice questions. So this is for today. Thank you.